In our series of Docplexus KOL Interview, today we have with us Dr. Madan Kapre, who is an internationally acclaimed ENT surgeon from Nagpur. He has a 35 years of experience in his field of practice. Dr. Kapre is both trained and practiced abroad, also in India. Dr. Kapre is an authority of thyroid surgery all over the world. There are several research publications to his credit, and Dr. Kapre has devised some surgical techniques that are assigned to his name only. Dr. Kapre is the Executive Council founder member of Asia Pacific Thyroid Society and also organizing committee member of World Thyroid Congress 2017. Dr. Kapre will be leading the Indian team of ENT surgeons there in the world platform. Thank you, Dr. Kapre, for sharing your valuable time with us. So initially, I would like to ask you, you have practiced both overseas and as well in India. So what are some distinct characteristics of Indian population with respect to thyroid disorders?
The main difference in the thyroid condition, in particular in our country, is that overseas, the thyroid disorders are picked up by the endocrinosurgeons or endocrinologists, so to say. And they are picked up because they have got some dysfunctioning gland. In our country, the reason why patients come to us with a visible mass in their neck, so that's a big difference. That they are going there with non-visible masses which are picked up by either the ultrasonologist or the endocrinologist, whereas our patients come to us with a very visible discomforting neck mass. That's a main difference. So they are diagnosing what I call the laboratory carcinomas. We are diagnosing what are called as a clinical carcinomas.
Okay. Sir, you have created the Nagpur Thyroid Registry. Can you highlight the notion and some of the key findings from this initiative?
Yes, this is something as a national pride that really hurt me when I was presenting papers and talking to people abroad. That we have numbers, we have got great numbers. You see, if they do one operation, we are doing 100 operations of that kind. But our drawback is our documentation is not good, our teamwork is not good, and we cannot substantiate our work with a very authentic, reproducible and acceptable data. In Nagpur, at any given moment of time, there are at least 4 or 5 thyroid operations done per day. So that's a huge number. Now look at the Western papers. Their largest series might be around maybe 1,000, maybe just over 1,000. We can compete that number if we all pull all our data together in no time at all. And that's the idea when we started, to get an authentic documentation of all our data. And happy to say that following Nagpur Thyroid Registry, we have 4 more registries working in our country which are inaugurated. One is working in Far East in Guwahati, one is working in Northern Thyroid which is in Saharanpur, one I'm going to inaugurate in Uttarakhand in Dehradun. And there are mushrooming because the idea caught up that let's pull our data together and put it on paper.
Okay. So what are the other initiatives to take up this problem of thyroid disorder to the world level?
As you rightly mentioned in my introduction, I heard correctly that in the World Thyroid Congress, which occurs once every 4 years, we are getting a 3-hour session which will be specially designed to discuss the relevance of our patients, our subset of advanced thyroid cancer vis-a-vis their micro or laboratory cancers which they are treating. To that effect, I could get 3-hour session in that meeting next year. In order to prepare our data, we are going to hold another conference which is called as Consensus Evolving Conference on the Management of Thyroid Cancer next month in Nagpur. We've done a lot of homework for it. All the thyroid surgeons are going to come together. We're going to form a national thyroid society for surgeons, and this society will make guidelines on the management which are relevant to us and not really getting carried away, because there are lots of differences in the infrastructural facilities. For example, if you take it post-operative radioiodine therapy. Now, if a Nagpur patient has to receive a radioiodine therapy post-operatively, he has to either go to Pune or go to Mumbai, or go to Hyderabad, or maybe Bhopal. Now it's an expensive thing to go there, stay there. We don't have it. So when we do our surgical planning, we should keep that in mind that my patient is not going to go all the way to Mumbai and stay there for a week or maybe longer if there's a waiting period to get a radioiodine therapy. So I will say my mainstay treatment will be surgical. So that's how small things will evolve. Let's wait.
Okay. So Dr. Kapre, as you are an authority of the thyroid surgery in India, I would like to ask you, what is the basic difference, key differences between a thyroid nodule and thyroid cancer? Do thyroid nodule contribute to thyroid cancer somehow?
Very small proportion. If you want me to ask about the incidence of thyroid cancers in thyroid nodule, it's very small. We don't have authentic Indian statistics on this, but the average consensus is about 1 to 1.5% of the multinodular goiters. When I say multinodular, means the person has got more than one nodule in his thyroid. When there is only one nodule in the thyroid, the chances vary between 4 to 12%. So some of them may be, and that is again we say whether it's a man or a woman, a young person or an old person, it varies, but not a great deal. Many of these are innocent, non-harmful nodules, and all of them don't need treatment.
As you have mentioned that solitary nodule is a challenge for ENT surgeon to manage. So what will be the basic thing by which we can investigate and manage solitary nodules?
Yeah, the basic challenge is to give a name to this nodule. What I mean by name to this nodule is, number one, is it really solitary or is it a dominant nodule of the multiple nodules? Because say there is a big man sitting in the front and there are two small people behind him, they will only see the fat man. There will not two people behind him. So something like this, that is a fat big nodule in the front and there are two small ones behind, suddenly the complexion changes, that this becomes a multinodular which is not cancer, number one. The second challenge which is faced by us is to identify what are the possibilities of this nodule being cancerous. To help us to come to a conclusion, we have got two frontline investigations. The first is a ultrasonography. The second one is a fine needle aspiration cytology. And again, there has to be a talk. We have to talk to each other. We cannot sit on an island. In fact, I have a wonderful slide where I was in Bangladesh that time, and they have small islands there, and I said that we need to have boats to travel between the islands. So a sonologist, a cytologist and the surgeon should exchange, and that's another advantage of thyroid registry, because we have all these people on board. So the challenge to a person is to give a name, benign, that is not cancer, or malignant, that is cancer. That's a big challenge.
Okay, so you emphasize on correct synchronization between a pathologist and the ENT surgeon that will help to distinguish.
You just stole the words. Yes, that's the right word. We have to have a team and a synchronized team which thinks similarly and talks similar language to deliver the exact required treatment to the patient. You are right.
Sir, there is a dilemma in general practitioners to refer their thyroid patient, whether to refer to endocrinologist or to refer to a ENT surgeon. So what will be the referral indications for them? Yeah,
this actually happens. When you get famous for something, all kinds of things keep coming to me. For example, I get people coming to me who essentially have a thyroid dysfunction. That means their thyroid gland is either working at a faster speed or a lesser speed. Now that's the domain of an endocrinologist. That's not the territory of a surgeon. Surgeons per se are involved two places: when there are tumors or the nodules in the thyroid gland, or the places where the physician is unable to handle this gland medically. So we only come in those two situations. On a very rare situation, which doesn't happen often, when there are telltale bad effects of thyroid, like you must have seen a lot of people with very big eyes, what we call proptosis, the eyes are bulging out, and those guys sometimes develop whatever orbitopathy or ophthalmopathy. There again we come into picture to elevate their eye symptoms, but that is not so common. My indication for a general practitioner that where he should send a patient is like this: if there is a palpable nodule or there is a tumor within the thyroid gland, then that's a patient which should go to a surgeon. But if there is a clinical suspicion of either hyper, that is excessive, or hypo, which is less, functioning of the thyroid gland, then that patient should go to an endocrinologist.
Okay, thank you, sir. And we, Docplexus, we are an online platform for doctors. It's a doctors network. So do you think such online platform can really help updating and connecting doctors across the country?
I think that's an absolute need of the hour, because what is happening, you see, I do not know what is happening in somebody else's field. He doesn't know what's happening in my field. It's one way of, I mean, there's a big, I don't know if it is a British telecommunication ad, let's talk. So I think we have to talk to each other. And unless we talk across with a forum like yours, I think the message won't go across. I think it's a very good initiative.
Thank you, Dr. Kapre. Thank you for your time.
Thank you very much, Docplexus, because it's a very interesting concept. I think many doctors should take full advantage of this empowering doctors, which exactly Docplexus means. This gives an opportunity for us to exchange views, to know about other people, what they are doing, and maybe in return enrich ourselves. So I think a lot of people should join, and I will say, actually, thank you for creating such platform.
To stay updated on our latest KOL videos and interviews, please subscribe our YouTube channel, like us on Facebook, follow us on Twitter. Happy Docplexing!